As the need for cataract surgery increases with global aging population and rising prevalence, improved safety and efficacy are required in every step of cataract surgical procedures. Accordingly, continuous efforts have been made to develop more sophisticated systems of cataract removal and IOL implantation. A handful of preloaded delivery systems are currently available to ophthalmic surgeons. Preloaded IOL injector systems, however, sometimes fail to meet the expectations of surgeons in terms of predictability, efficiency, and safety. The advent of foldable and injectable lenses, particularly those made of a hydrophobic acrylic material, made temperature an issue. The properties of acrylic IOLs change dramatically with temperature increase. A physiologic temperature results in a soft, flexible lens that folds and unfolds easily, whereas the cool operating room temperature causes the lens to be stiffer and more resistant to folding and unfolding. This 1995 footage displays how IOL warming was a standard pattern for IOL folding with forceps, and serves to set an example how old behaviors can be beneficial to our practice. In our practice over the past 25 years, the IOL packing is introduced inside a folding heating pad, readily commercially available, at medium temperature setting at the beginning of the case as shown. Temperature measurements monitored with an industrial thermometer displayed an average of 92 degrees Fahrenheit, 33.3 Celsius. The fact of the matter is that all you need is some lens warming for at least 10 minutes, and there isn't any need for a rigid temperature control. Of course, we closely watch the temperature, and the heating pad has an auto-shut mechanism. It is common knowledge the interaction between high temperature and the formation of SSNGs, especially in the AquaSoft platform. Although we have not experienced the early occurrence of glistenings in our series, it is difficult to determine the causes and the beginning of this phenomenon clinically. Further controlled laboratory studies are necessary to elucidate this common clinical finding. Note the difference in AquaSoft folding and unfolding in a warmed and unwarmed lenses. The major drawback is that the lens becomes stickier and more awkward to handle for folding the haptics. Proper IOL handling is paramount to avoid scratching the optic surface. Now, let's compare the incision size between them. As seen here, there is slightly less incision enlargement with the warmed lens. Another key advantage is the implantation of high-power IOL as seen with this 37 diopter acrylic lens using a C cartridge. We can also use the D cartridge for routine implantation of the SA60 clear lens as seen in this footage. Lens warming also allows us to mix IOLs and cartridges from different makers as seen on this implantation of a Técnica ZA9003 three-piece lens using an Alcon C cartridge, or a Bausch & Lomb and Vista using the unfolded Platinum One system. Regarding the injector systems, we had experience with the Alcon UltraCert push time and the Autonomy automated lens advanced type, and with the Hoya 255 screw type. As seen on the screen, there is an increase in the speed of lens unfolding, and for us the main advantage is that they go through tighter incisions without compromising wound integrity and sealability. On slit lamp examination, please note the pristine aspect of the IOL on the next day with no IOL damage whatsoever. There have been several studies demonstrating IOL fracture and cartridge cracking, especially when they are implanted through tighter incisions at room temperature. None of the studies compare injector systems, cartridges, resistance force of injection for both Incision sizing, IOL strax fracture were performed in a warmed lens. Further laboratory studies are necessary to corroborate what's being presented in this film. Until we have scientific evidence against this practice, we are recommending warming acrylic IOLs for the sake of our patients. Thank you very much for your kind attention.